Hello, I'm Jeremy Fernandez. Coming up on the virus, Victoria takes a significant step out of lockdown as restrictions are eased across regional Victoria. Plus, the Oxford University and AstraZeneca vaccine trial resumes as concerns grow across Europe that another wave of the pandemic could be about to hit. But first, there's been some good news for Australians stuck overseas. State and territory leaders have agreed to raise the cap on international arrivals. They made the announcement following National Cabinet after the Prime Minister insisted in allowing 2,000 more Australians to return home each week, starting from next Friday. However, it'll be at a slower pace than Scott Morrison would have liked because Queensland and Western Australia want more time to boost their hotel quarantine capacity. This means that the cap will be gradually increased over the coming weeks.
It will be done in a staged way. New South Wales will move to take an additional 500 by Monday week, so that's the 27th of September. Queensland and Western Australia on that same day will be taking an additional 200 per week from the 27th of September. By the 4th of October, Queensland will then move to that full 500 extra, so they'll increase it by 300 again. And by the 11th of October, WA will also go to that 500 extra a week.
In Victoria, case numbers are falling faster than expected. There are now predictions that Melbourne could see restrictions eased again by the end of this month. There were 45 new cases and 5 more deaths overnight, taking the state's coronavirus death toll to 750. It's the 8th consecutive day Victoria has recorded fewer than 50 new cases, but it is an increase on yesterday's tally of 28. Today, the 14-day case average is down to 42.7. That's down from yesterday's 44.4. That's well below the predicted 14-day case average of 63. And these are encouraging figures. The next step on Melbourne's roadmap to easing restrictions will happen after September the 28th. That's Monday week, if the 14-day average stays between 30 and 50. Regional Victoria is already enjoying relaxed restrictions, which has given those outside Melbourne a huge boost in morale. People have been able to venture out to pubs, cafes and restaurants for long-awaited catch-ups with their friends and loved ones.
It's been a long, cold winter away from good mates.
It's bloody fantastic, after being in lockdown for so long.
Coffee's up without takeaway cups.
Strong double shot latte. That's what I needed.
The mandatory masks prevent facials, but some beauty services are back on.
Oh, it's absolutely marvellous.
For many regional businesses, it's a day to savour after surviving not just one, but 2 shutdowns.
Today it's been amazing just to have that, interaction with people and then just talk to people and then discuss things and how's life with them, and you haven't seen them for a while.
In the state's north, the New South Wales border restrictions were suddenly lifted last night, a pleasant surprise for many.
We're actually planning our honeymoon now that we can actually leave the state.
Yeah, we eloped on Saturday, so we didn't think we'd be able to go away, but now we can.
The 50-kilometre border bubble remains in place, but for those within that zone, tourism and recreation on the Murray River can resume.
Got some new equipment. They've recently purchased a racing hull for people of my weight. And I haven't had a chance to row that in competition yet, and I'm really looking forward to that. It'd be great.
When school holidays start this weekend, caravan parks in all corners of the state will be flooded with holidaymakers.
Ever since we found out that regional Victoria was able to travel, the phone has not stopped. It's been a busy couple of days. It's a huge relief, really, really exciting.
And when the holidays finish, regional primary schools will begin the transition back to classroom teaching straight away, a week earlier than planned, although high school students still face a staggered return.
We'll continue with the settings that we had, that is, we keep our secondary schools free for assessments and the GAT on the Wednesday.
As promised, motorists face long waits on the urban boundary, where beefed-up security made sure that no one left Melbourne without permission. While people in regional Victoria are enjoying some much-needed pleasures, they're looking forward to seeing their loved ones in Melbourne soon.
We miss you, Melbourne!
Amelia Turzon, ABC News.
There's been some good news for Canberrans this week as well, with confirmation that South Australia and Queensland will open their border to those from the capital. Queensland will open up to the ACT at the end of next week. South Australia did the same at midnight on Tuesday. People coming from the Territory will have to declare they haven't been to a hotspot, which is considered anywhere in New South Wales or Victoria. It also means residents will have to arrive by plane. They won't be allowed to drive through New South Wales to enter Queensland. In New South Wales, the restrictions on the number of people who can attend live sport is set to increase in time for the NRL Finals series. 3 stadiums will be allowed to operate at 50% capacity, meaning the Olympic Stadium will be able to host 40,000 people. Fans will be expected to socially distance and wear masks when getting to and from their seats. As the weather warms up and we head towards summer, there are lessons to be learned from Europe. Many countries eased restrictions to make the most of the sunshine, but are now facing a surge of COVID cases. But unlike Europe, some parts of Australia have effectively eliminated the virus. I spoke with the infectious diseases specialist, Associate Professor Sanjaya Senanayake from ANU a little earlier. Dr. Senanayake, welcome to The Virus.
Hi, Jeremy. Pleased to be here.
Tell me, what's your sense of what's going on in Europe at the moment and why certain countries are seeing these surges of coronavirus yet again?
Yeah. So, Jeremy, I think we have to look at Australia and Europe as being, I guess, 2 different beasts when it comes to COVID-19. Many parts of Australia have actually met the definition for elimination of COVID-19. So we haven't seen cases of community transmission with an unknown source for over 28 days. But generally, Europe has not met that definition. There's been ongoing virus transmission since the pandemic first started. So they've really been trying to control things rather than eliminate things. Initially, in fact, President Macron said we'll go to war and sort of beat this virus, but I think now he says we have to learn to live with it. So that's why it's different. And of course, if you are trying to control the virus, so you accept certain amounts of cases every day, there's always going to be the chance that you're going to see a surge. And not surprisingly, this seems to coincide with a lot of countries lifting restrictions. So now Spain, I think, is the fastest, or one of the fastest, if not the fastest spreading country in terms of this surge of COVID. And that's been associated with a lot of pubs and bars and nightlife areas being opened again. So the popular tourist attraction of Malaga has opened, and you can see packed tourist sites full of people. In fact, there's this iconic image of a DJ at a club just outside Malaga who spits his mouth full of beer all over a packed audience listening to rave or some sort of dance tune. So that's the sort of thing that's feeding this. So lifting of restrictions in a place which had only control, not elimination.
Now, these lifting of restrictions have also coincided with summertime, and there's concern here in Australia that summertime is going to be, particularly in states like New South Wales and Victoria, going to be a super spreading event. What do you think the chances of that are?
Yeah, so I guess the good thing about summertime compared to winter is things are going to more likely happen outdoors. And particularly there was a Japanese study which suggested that the risk of transmission outdoors with COVID-19 was around 18 to 20 times less likely than indoors. So that's one good thing. But I guess that may be cancelled out somewhat by the fact that there will be large gatherings of people. And you just get the sense from what we've seen over the last few months that there are young people who are just complacent and fed up and who aren't going to physically distance. So I think, yes, we're going to have that issue of being outdoors being a good thing in terms of virus transmission being limited somewhat by the fact that lots of people are going to go outdoors and may not physically distance. So we might see some surges of cases.
So as we head into summer here in Australia and in the Northern Hemisphere, they're heading into winter, temperature-wise, in terms of those conditions, does that change the transmissibility of the virus?
Well, yeah, that's another good question. Initially, when we're learning about this virus, and we're still learning about this virus, we thought, well, this respiratory virus has caused a huge number of cases in the Northern Hemisphere in winter. Therefore, it's probably worse in winter because we also know that respiratory viruses tend to spread more in winter in general, such as influenza. This is probably due to changes in humidity and the fact that people are indoors and closer together. And in many ways, many of us were thinking we were going to have a torrid time in our southern hemisphere winter. But really, I mean, we did, of course, have this big outbreak in Victoria, but that was for other reasons. The winter factor didn't seem to be such a big issue here. And conversely, if you look at hot, humid countries, they've also been affected by COVID-19. I mean, a small country like Singapore with about 5 million people, hot and humid, has had, over 40,000 cases. So I think weather isn't a huge factor with this virus.
In some countries, such as Sweden, they've toyed with this idea of herd immunity. And you mentioned this idea of living with the virus and kind of recognising there will be some degree of community spread continuing for a long time. What do you think the merits are of that approach with herd immunity in countries such as Sweden?
Yeah, I don't think herd immunity works if we're trying to do it through natural infection. If you're trying to do it through immunisation, that's a different matter. But the issue is that, first of all, many months into the outbreak, a lot of countries in Europe and areas of the United States did antibody testing to see what proportion of the population had been affected. And I think it went up to high as 20%, but generally only about 10% of the population had been infected. And if you wanted that herd immunity, you'd want at least 60, 70% of the population infected. So we weren't anywhere near that. And also, we don't know how long someone's immunity lasts for. And we know with other coronaviruses that the immunity can be limited. And we've already had that case in Hong Kong where one person has demonstrated reinfection. So I think herd immunity, using that as the basis for your national strategy against COVID, isn't the best idea. But you did mention Sweden. And if you look at Sweden now, they're not doing too badly in the sense they're probably having about 300 cases a day. Compared to, say, the UK, which is having 3,000 cases a day, and they're having daily deaths which are in single digits. Now, of course, Sweden, even though they didn't have the government strictly enforce restrictions, they gave a lot of messaging for the public to do so and left it up to the people. And I think the people have adhered to that. So there is social distancing and some precautions being taken there. And, of course, in their earlier outbreak, they had a lot of deaths due to aged care facilities. So I'm presuming at this stage of the outbreak, they're protecting those aged care facilities more, so you're not seeing as much deaths.
Now, here in Australia, national cabinets met again to consider this issue of bringing back those tens of thousands of Australians who still haven't been able to come back. Are you concerned about the lifting of those restrictions, so more people being allowed to come back, and what that means for the hotel quarantine system, which, as we know, has failed in parts in the past?
Yes, so, Jeremy, the hotel quarantine system is the high-risk system, or the highest area of risk in terms of reintroducing COVID into our community. So, therefore, we have to make sure that those protocols are strictly enforced and remain in place, irrespective of the numbers of travellers who are coming in. So I guess if the federal government is doing this, we need to ensure that whatever resources are needed to maintain the current infection control standards are met at whatever cost. Otherwise, COVID-19 will be reintroduced into the community. And of course, we saw with Victoria what the consequences of that can be.
Dr. Senanayake, good to have you on the program again. Thanks so much for joining us.
Thank you so much, Jeremy.
And as we were discussing with Professor Senanayake, weekly coronavirus cases in Europe are now exceeding those reported at the peak of the pandemic so far. Restrictions are again being imposed after they were relaxed for the European summer.
This is the queue you don't want to be in.
I've been trying online every hour, on the hour, for 4 days, and I finally got an appointment last night.
The testing system in the UK is at breaking point and the virus is rampant. As part of measures to try and reduce it, The British government's now banned socialising for 2 million people in 7 areas in the northeast of England, where the case numbers are 3 times the national average.
We agree with the local councils that we must follow the data and act, and the data says that we must act now.
Mixing with other households is now banned. Pubs will need to shut by 10 p.m.
I think it's a good idea in a way with the pubs closing earlier to stop big gatherings of people, but I don't think the household thing is really fair.
The World Health Organization is shocked by what it's seeing. The number of new cases in Europe is now higher than it was during the peak of the pandemic in March.
Last week, the region's weekly tally exceeded 300,000 patients.
France reported a record number of infections, more than 10,500 in a single day.
C'est la panique, quoi. It's a panic, a real panic. It's stressful. And the doctor's website tells me there's nothing until the end of September.
And more than 200 people lost their lives in Spain, marking the highest death toll since June. Cases in the UK are also rising. It had around 3,000 a day for the past week.
Introducing a second national lockdown would be devastating for the UK economy that's already in recession. And Boris Johnson says he just won't do it. Instead, the British government is putting the onus back on the people with a message: if they want to save Christmas, they need to stick to the rules.
There's not long left to turn things around. Samantha Hawley, ABC News, London.
Now, there is some good news out of Europe in Oxford University's coronavirus vaccine trial, which is set to resume. The studies being done with the pharmaceutical giant AstraZeneca were abruptly suspended last week after a reported side effect in a British patient. The work has now been deemed safe to continue. The Australian government has signed a deal to secure the vaccine if the trials are successful.
The latest advice we have from the company to my office as early as this morning is that the timetable for vaccine provision to Australia is unchanged, with early 2021 continuing to be the expected timeframe.
18,000 people have so far received the vaccine as part of the trial. Donald Trump has slapped down one of America's top health officials who contradicted the president by saying a coronavirus vaccine may not be available until the middle of next year. The president claims Dr. Robert Redfield was confused and insists a vaccine could be ready as early as next month.
The president has a simple message: as soon as the vaccine is approved, let the injections begin.
Could be announced a little bit after October, but once we go, we're ready.
Not so fast, says the director of the Centre for Disease Control. Even if limited supplies are available this year, most people will have to wait for up to a year for their shot.
I think we're probably looking at late second quarter, third quarter, 2021.
And Robert Redfield added another surprise statement that won't have endeared him to Donald Trump. Wearing a mask could be better than a vaccine.
If I don't get an immune response, the vaccine's not going to protect me. This face mask will.
Mr. Redfield added if all Americans wore masks, the nation would gain control over the virus in just 3 months. Not messages a president seeking re-election wanted to hear.
I think he just made a mistake. I think he misunderstood the question, probably.
The polls show Donald Trump's credibility on COVID-19 is running low. His Democrat rival Joe Biden is taking full advantage of the president's vulnerability.
Worst of all, he made clear that he still doesn't have a plan to bring us out of this crisis.
The president says his actions saved more than 1 million American lives, and he produced a graph to back him up. But what many see is the highest death toll in the world's richest nation, nearly 200,000, and a leader who failed to protect them. Joe Biden says if he becomes president, he'll call state governors to Washington to convince them to issue a mask mandate. And if there's still resistance, he says he thinks he has the power to make nationwide mask orders. And he said that will save tens of thousands of American lives. Philip Williams, ABC News, Washington.
And that is this edition of The Virus. I'm Jeremy Fernandez. Thanks for your company. Don't forget you can catch up anytime via the ABC iView and ABC Listen apps. For now, stay safe. See you next time.